Dr. Siddharth Chatterjee. I work as a project lead and the chief surgeon of Narayana Super Specialty Hospital, and we have a ABMSS Comprehensive Cleft Care Center for the last 1 year. So I'll just walk you through the review of 2024 and 2025, how things got so far. So we come to the first slide. Between May 2024 and 2025 June, the center has treated over 276 patients, delivering full spectrum of services including speech, NAM, orthodontics and surgeries, nutrition support and psychological counseling. The strategic shift saw smooth transition of patients from Sri Jain Hospital to Narayana Health, facilitating access to advanced infrastructure while preserving the continuity of care. Reactivation of comprehensive cleft care services filled a critical care gap which was met with enthusiastic participation from the patients. Timely reporting from us ensured and sustained smooth support and the program stability. As the center enters into the next phase, priorities include maximizing the outreach, strengthening caregiver and community education, enhancing digital health through ABMSS app, and fostering new CSR partnerships in West Bengal region. It's probably the only center provides comprehensive cleft care services including surgery, orthodontic, nutrition, psychological counseling under one roof in a JCI accredited corporate hospital. Serves patients across the urban and rural regions, focusing on both on the lower and middle income group for equitable access. So the key performance indicators throughout the year: the number of patients treated are total 279, the surgeries performed are around 163, the orthodontic enrollment is around 8 patients, speech therapy we have given to 83 new patients, and nutrition we have delivered to 25 new patients, and the follow-up compliances of all these patients are around 95%, which is a very good. Now the clinical outcomes throughout 1 year in a corporate setup with high infection control, the infection rate is nearly negligible. All the surgical patients have been discharged on same time duration. None of the patients required readmission. The patients have been thoroughly evaluated for surgery before admission. The fistula rate after cleft palate has dropped to 0.01%, which is nearly negligible. And partial lip dehiscence has been seen in only one patient. Speech therapy outcomes have already started showing improvement in a few months, and 90% of the patient which has been enrolled for nutrition program have already gained weight for surgery. And complex orthodontic cases have been taken up by Dr. Krishnendu with the help of our mentor, Dr. O.P. Karbanda, who has a vast experience in cleft orthodontics throughout this piece and is a stalwart. So we'll walk you through a few post-op photographs. These are of the unilateral cleft lip surgery. The patients are so happy and smiling. These are our beneficiaries. Next. These are the happy mothers with their child on their lap just after suture removal. You can see the happy faces, how the child, mother, all of them are happy. This is the cleft palate results. Just to capture two of the patients, there are many, and we can see a clean palate in this. And these are a few more patients who have undergone cleft lip surgery. Next one. Yeah, these are the four more happy patients who have undergone cleft lip palate and surgery. This is a photo of the patient post-op sitting in a ward, which is a high standard cleft ward or the pediatric ward with lot of backup pediatric nurses, pediatric intensivists seeing the patients throughout the day and night. And this is just post-op day 1 of a patient with a happy mother, a happily sleeping child with a ABMSS. And this is the background of the hospital lobby, from where we can see the entire lobby at one view. This is the first floor. We have the OPD's house there, and this is how the speech therapy department looks like, and the speech therapy services being undertaken by our speech therapist Paromita Pal. This is our orthodontic patients who have been undergoing orthodontics at Narayana Hospital, and by Dr. Krishnendu and mentored by Dr. O.P. Khar. This is Paromita, our speech therapist. She is very efficient, and she takes care of all the cleft palate children who are referred to her for speech therapy. She has numerous ways and means how to motivate them, how to attract them, and how to keep them glued to the therapy process throughout the period of time. And this is our dental of the orthodontic department, Dr. O.P. Kharbanda, explaining complex cases to our orthodontist Dr. Krishnendu, who is a well-experienced orthodontist, having more than at least 6 to 7 years of experience in cleft orthodontics itself. This is Paramita, our speech therapist. She is very efficient, and she takes care of all the cleft palate children who are referred to her for speech therapy. She has numerous ways and means how to motivate them, how to attract them, and how to keep them glued to the therapy process throughout the period of time. And this is our dental of the orthodontic. These are the patients who have been waiting for the orthodontic appointment before the department. The nutrition, feeding, and the psychological counseling is undertaken by me itself, and this is the very critical stage at the because mostly the patient comes in for the first time to see the surgeon. They're apprehensive. They have a lot of fear. They have a lot of fear regarding the surgeries, what will happen, how it will happen, and most of them are underweight. They are unable to feed the babies. So I take up the nutrition and psychological counseling for the patients as to how to hold the bottle, where to hold the baby, how much feed to give, what is the importance of supplemental feed, what if the baby is not getting weight gains. So all these are done, and totally free of cost nutrition, whatever is required is given by ABMSS to the patients, and we have a follow-up of the patients till the surgery every 15 to 20 days to 1 month on the tendency of how the patient is gaining weight. We do extensive search and awareness camps across the state of West Bengal. This is Sarul, our patient coordinator, who moves around the villages, around the districts with our ABMSS car fitted with a mic above. So he goes on telling about the free of cost nature of the surgeries, and how the patient can enroll for the program, and how the patient who has already been operated, they can undergo rehabilitative therapy like speech therapy, orthodontia at our Narayana ABMSS Comprehensive Cleft Care Center, absolutely free of cost. So these are few glimpses. We can go forward. Yeah, this is how the camp is undertaken, and the patients are identified at the village level. These are more pictures of him moving around, because he forms a pivotal role in our ecosystem, because without identification and search awareness, patients are not going to come to us, and they are not informed that such a beautiful, efficient cleft care center exists, where you don't have to pay anything, and that also in a corporate hospital. So there are some few problems running a cleft care center of high volume in a corporate hospital. A few of them being, they have rigid budget structures. The corporate hospitals often operate with centralized budgeting protocols, leaving limited flexibility for the charitable care specific needs like cleft care. In spite of that, Narayana Health, having a mission or tag of health for all, is considered especially about the pediatric surgical care, because the care for the babies are at a different level. While Narayana is known for the cost efficiency, balance affording care with profitability can be tricky, especially for the services that are less revenue generating like cleft care. Cross subsidy models exist, but surgical interventions may struggle to secure adequate budget compared to high revenue generating surgical specialties like robotics, oncology, and cardiac care. But one favorable point about it is the pediatric surgical care at Narayana Health has been 80% dependent on government fundings and NGOs like us. We are slowly getting engaged in Narayana's in-house awareness camps, health education events, and referral network building capacity. And the financial overview, what we look at, data-driven funding pressure is there. Budget decisions are heavily influenced by financial dashboards and KPIs, which may not fully capture the patient impact or social value. Services with qualitative outcomes may be undervalued in budget reviews. Limited scope of philanthropic flexibility. While Narayana does engage in subsidized care, but philanthropic work are often earmarked as charitable gesture, which must be limited to a certain capacity. But once the child is inside the hospital being treated for a surgery. They are never treated otherwise like the insurance or the cash patient. The same quality of care delivery is given even to the NGO patients or the charitable patients also. There is no differentiation in it. I can vouch for it. Looking ahead, we look forward to make a data-driven care and EMR integration leveraged through ABMSS EMR for real-time tracking of cleft milestones. We want to build LinkedIn dashboards for the comprehensive care reporting, financial stability and advocacy. We want to advocate for a reasonable cleft care budgeting within Narayana's corporate framework, explore philanthropic partnerships and CSR fundings for surgical services, position cleft as a model of socially responsive care within private healthcare, expanding geographic reach. We plan satellite centers, screening camps in eastern India and undeserved pockets of the West Bengal region, and we have to make a hub and spoke model for the RBSK and NH as an anchor and community leads at the feeder, so that we can spread more awareness at less cost. Thank you.